The lymphatic system tends to be a little bit undervalued, but really, removing toxins and waste from the body is vital to everyday life. Today, Emilia Dewi, a certified lymphedema specialist, is here to help us understand and navigate life with cancer-related lymphedema. If you're interested in occupational therapy, this is the place for you. This show aims to explore our profession by sharing who we are and what we do. Because for us, occupational therapy is more than just a job. Hi, I'm Sarah. Welcome to OT for Life. Hey, Emilia. How are you doing today?
Hey, I'm doing good. How are you?
I'm really good and really, really excited to be talking to you today.
Yeah, me too. I'm really excited because we're going to be talking about one of my favorite subjects in therapy, which is the lymphatic systems, or in life in general, actually. So yes.
Yes. And honestly, let's just jump in because I think there is a lot to discuss and a lot to unpack with the lymphatic system and really the importance of it for us as occupational therapy practitioners. So to start, I want to know why the lymphatic system is so important to you. Was there an experience or something that happened that you remember that just resonated and really just kind of connected and you were like, yeah, this is something that I really want to dedicate my time and my energy into researching and working with?
Good question. So I think that happens in multiple, events in my life. So the first time I get exposed to lymphedema or the dysfunction of the lymphatic system as we know it was when I was in my clinicals, actually. I was at USC University Hospital and my CIs happened to be lymphedema certified. So I saw firsthand, number one, how lymphedema can be, or even swelling in general, can be very devastating at the acute care level, right? I mean, somebody would be passed out in the ICU for a long time and their limbs got swollen, their genitals got swollen, their abdominal got swollen, and you just can see how uncomfortable that is. And then it can cause your skin to be thinning, especially when you're older, and then it can cause them to develop some wounds. So it becomes a really big issue. But then also she showed me the outpatient side of things. And I think that kind of really what marked me to remember, because number one, I saw how the treatment that was done really make a big difference. And then number two, on the flip side, I saw the implication of not taking care of your swelling and the long-term outcome of that. I will never forget this. So there was a guy who came in and he's probably in his 40s or 50s. And he has lymphedema in his legs because of venous insufficiency. But it has progressed so much. So there's different stages of lymphedema and I can talk more about it later. But the first stage is when everything is just swollen, but then it can easily reversible. The last stage is when it becomes really hard and to some degree can even look like a tree trunk. So you can see the progression from just a swollen limb to a limb that looks like a tree trunk. So this gentleman is kind of in the later stage. So his limb was completely hard. He has a pretty deep wound and infection on his leg. So whenever he come to therapy, he would receive wound care from the physical therapy, and then he would receive lymphedema treatment. And at that time in the USC outpatient therapy, all the rooms are just split with a curtain. So you can hear exactly what's happening on the next room. And I can hear this man just in agony as his wound is being cleaned. And I can smell just the infection. I will never forget that smell. So, but at the same time, I see the changes that the therapists are making. I see, the changes that the treatment is making. And I see how the limbs, when it's treated in earlier stage, can completely reverse. And then somebody can have their almost normal way of life back. So I just see the value of the treatment and there's just so much just science behind it. So I was like, okay, this is great. But then it wasn't until 2013 when I got certified as a lymphedema therapist. So I graduated in 2010 with my OTD and then I got a job in an acute care setting. And in 2013, I was in Houston working for an outpatient therapy clinic that focused on neurological rehabilitation. But at that time, we were starting our lymphedema program. So I became one of the first OT to get certified and the rest is sort of history.
I feel like, gosh, there was so much that you just said there. And I feel like, it happened very early on for you that you made that connection that you're like, there's something going on here. And then the fact that, and I know we'll dive into it a little bit more, but how the lymphatic system influences and has such an impact on people and their lives and their occupations and how they are able to do or not do those occupations. And so really like understanding this whole kind of big picture. It's not just swelling. There's so much more kind of at this deeper level that impacts a person when they are experiencing some sort of disruption, some sort of something that's happening with their lymphatic system. So it's like, I'm really excited to really just like dive in and start to understand this even more, because it's not something that I work with a lot, but I have seen it a little bit in pediatrics. But yeah, I think it is something that's really, really important to kind of highlight what specifically is going on and then how it kind of affects our practice as occupational therapy practitioners.
Yes, and absolutely. Because I think sometimes we are the first one to notice it. And, before that experience at USC Hospital, I saw swelling before. And I saw how people manage it. Okay, retrograde massage. You hear it in school, right? You do taping, you do maybe movement, but then it never goes beyond. I mean, it never went beyond that, right? It was just, oh yeah, you do this massage, it will go down. You do movement, it will go down. But you never really see the picture of like, okay, what if it doesn't go down? Like what happens?
Yeah. So maybe let's kind of start the conversation about what it is and maybe kind of highlight a little bit about like certain things that you might expect to see or kind of how it presents in the clients that you're working with, and just kind of like share a little bit more about like what the lymphatic system is.
Okay, so I'm going to start with what the lymphatic system is, and then I'm going to go to where it may present in your clients or our clients. So the lymphatic system is a part of your transport waste system and also the immune system. So it actually balances the fluids and the protein in your circulatory system, and it transports about people generally saying 2 to 5 liters of fluid every day. So that's a lot of fluid, right? If you think about a gallon of water is 3.78 liter of fluid. So that's how much that your lymphatic system is transporting every single day. So it has about 600 to 700 nodes. And the nodes is part of the filtration system of your lymphatic system. So they're not too big. They're pretty little. But imagine you have 700 of them, most of them in your neck and your intestines because it's part of your filtration system, right? And then you never heard anything about the lymphatic nodes. However, I heard this from Dr. Nicholson and I thought it was brilliant. Whenever somebody has cancer, right? If somebody was diagnosed with cancer, guess where the doctor's going to check next to make sure that the cancer is not spread? The lymphatic nodes. And until that point, the lymph nodes, like nobody knows what it is. It's just this little nodes in our body. But then when you have cancer, it's become very important, right? So, there's more to the story than that. And I think there's just a general, not misunderstanding, but lack of importance in the lymphatic system. Even in the lymphatic community, we joke about it all the time, but we say that, in the medical school, doctors only get about an hour or 2 hour lecture of lymphatic system. And I do hope that it's changing because there's so many research that have been coming the last 2-3 years about the importance of the lymphatic systems in the immune system, in the brain, in the cerebrospinal fluid. I mean, there's just so much that's been published out there in the last 3 years that I think is going to change the medical school and the medical teaching the way we know it today. So back to the lymphatic system, it is colorless, so you can't really see it. But once you smell it, you will never forget about it because it is part of your waste removal system. So it has a distinct smell that is almost like, what can I describe it as? It's almost like the sewage system. Yeah, so you will never forget it. Once you smell the lymphatic system, I have a patient once who come in because she has swelling in the legs and then she wrapped her legs too tightly that literally her shoes were filled with this colorless fluid that I'm talking about. So yeah, once you see that, you will never forget about it. So because it is part of your waste removal system, it removes your cellular debris and foreign material. So it's one of the best systems that we have in our body to help fight infection. And it's also our primary defense against cancer because cancer is the foreign, material in our body. It also helps to absorb fat molecules. It helps to assist with fat digestion. That's why we have so many in our intestines. And like the biggest talk right now, I think the one that really blows my mind is that have you heard of the lymphatic system?
No, I don't think so. I feel like I've heard like the word pop through, but then I'm like, yeah, I don't think so.
Yes. So that's kind of like even new to me. I think I've heard about it in the last year. So, and I've been kind of like practicing this for about 7 years. So the lymphatic system is the part of the lymphatic that drains your cerebrospinal fluid, your brain interstitial fluid, and the meningeal lymphatic system. So it drains your brain, right? I mean, okay, so just take that for a minute. So usually the lymphatic system drains when you sleep. Now putting it together to how much people don't sleep right now, like that's a big thing too. But there's also studies now that shows that links the connection between the lymphatics and the impaired lymphatic system with Alzheimer's disorder. Because, yes, right? I mean, I know. So there are a lot of research study right now that's looking at the impact of the impaired lymphatic system and connecting them with idiopathic normal pressure hydrocephalus and Alzheimer's disease. The research is showing that there's a buildup of brain metabolic waste and amyloid beta plaques in these patients, the one who have the Alzheimer's disease and idiopathic normal pressure hydrocephalus. So I guess like a very simplified look of this is that if you're not sleeping, number one, you're not really draining your lymphatics. And if your lymphatics is not draining or there's a disruption other than sleeping, then you might have a buildup of your brain metabolic waste, including this one protein that's called amyloid protein that has been linked with Alzheimer's disorder and idiopathic normal pressure hydrocephalus. Isn't that crazy or what?
Yeah, I'm totally just like mind blown at the moment. And I'm like, wow. I mean, it's all these things that we are preached about in OT school and as a practitioner of the importance of sleep and the importance of diet and the importance of exercise and the importance of all these things that we need to do. But I mean, this is even taking it a step further of like understanding why those actions are so important, because I've never even thought about the brain draining. I've never even thought about that, A, and B, I've never thought about like that happens when you're sleeping. And then the importance of then like how that connects potentially to some of these disorders maybe later on in life. Like I am literally just like, wow, this is so fascinating.
Yes. And, like there's also research now that shows that the lymphatic system actually plays a role in inflammatory and autoimmune disorder. I mean, that kind of makes sense because, the lymphatic system is part of your waste removal system and in part of your immune system, right? So if something were to happen with the immune system, then, then we have what we know now as autoimmune disorder, as, like multiple sclerosis. I mean, there's just so much implication to it. So I really think that the lymphatic system is the one system that is not really looked at, but it's actually one of the most important systems in the body. I like the way Dr. Perry Nicholson described this. He has actually a course for healthcare practitioner to study more about the lymphatic system, right? So he called it Lymph Mojo Body Aquarium. And the way that he describes it is like lymphatic system is your aquarium. So when your aquarium is not really working and it's not really filtering, what happens? The fish that you put in the aquarium will die. In our case, unfortunately, those fishes are our organs in our body and our cell health. So there's just so much that we are still studying and we are still learning about the lymphatic system. So yes, if you want to study more about the lymphatic system, you can go. There's just so many resources. So I'm going to send the resources to you or I'll publish it in my page somewhere.
Yeah, we will make sure that anything that you've mentioned already or anything that we talk about in the episode, there will definitely be links in my show notes to all of those resources. So if people do have more questions or they want more resources, they want to look for the research and all that kind of stuff, we will make sure that we have links to it. Now, based on everything that we've been talking about so far and everything that you've said, the lymphatic system can have implications kind of across the board with lots of different disorders and diagnoses and all these things that are happening. But I know that you have a specific focus, maybe a specific passion, specifically working with cancer-related lymphedema. So let's focus a little bit more on that, because I feel like we could talk about the general lymphatic system for days and days and days and still not even cover everything. So let's take a little bit deeper of a dive looking into cancer-related lymphedema.
Yes. So my specialty area in this case would be breast cancer-related lymphedema and head and neck cancer-related lymphedema. I have seen a few patients after cervical cancer or pelvic cancer, but that's because they normally go to a pelvic rehab therapist as well. So I don't see them as much. So I will go and just kind of start talking about why cancer treatment can cause lymphedema. And then I can talk about kind of more like the implication of what does it do to function and what does it do to their care. So I don't know if everyone's familiar with the way cancer is treated. So I'm just going to talk a little bit more about it before going on to how the lymphatic system is connected. So when somebody got diagnosed, let's just pick breast cancer for now, because a lot of people know about breast cancer, right? So if somebody got diagnosed with breast cancer, usually through mammograms or through self-examination, they would then get tested to see if their lymph nodes is affected. So usually they would have a mammogram after they cancer is suspected, and then they will have a biopsy to see the stage of cancer. So at that point, then the doctors and the team would determine what kind of treatment this patient would have. Generally, the treatment will consist of surgery. It's either a lumpectomy, where they only remove the tumor, or mastectomy, when they remove the whole breast tissue, combined with possibly chemotherapy or hormonal therapy, depending on the stage of cancer that they have, and possibly radiation therapy, again, depending on the type of cancer and the progression of the cancer that they have. So right now, it's very standard practice for the doctor to go in and assess the lymph nodes. So the axillary lymph nodes, which is in your armpit, is the one that is draining the brain. So the reason why the doctor want to check that is because if the lymph node is affected, that means the potential for that cancer to spread is higher. So they would take a couple of the lymph nodes that's been shown that those are the nodes that drains the brain, and take them out and assess them to see if there's cancer in those lymph nodes. So that's called sentinel lymph node biopsy. So for somebody to have lymphedema after a lymph node biopsy, the chance is about 3 to 7%. So if you think about it, the lymph nodes is part of the filtration system of the lymphatic system, right? So when you take it out, number one, there are less lymph nodes available to do that process. And number two, the scar tissue that happens because when the lymph nodes are taken, causing that just blockage in the pathway. So then the lymphatic system does not drain as well as possible. So sentinel lymph node biopsy, when 2 or 3 nodes are taken out, the chances are about 3 to 7% for somebody to have lymphedema after. Now, if we do lymph node biopsy combined with radiation and chemotherapy, or one of them, the chances went up to 30%. So that's a huge jump. Okay, and then sometimes when when the cancer already more progressed, then they know that, okay, the lymph nodes is affected. They see it through imaging, through what they call the fine needle biopsy. So they will have to take all the lymph nodes. That is called axillary lymph node dissection. So when somebody has that type of procedure, or we call it ALND, the chances for them to have lymphedema is 12 to 20%. Now, ALND combined with radiation, the chances are 40 to 60%.
Oh my goodness.
So, I mean, this is according to research. So there's variation in the numbers, but you can see the difference, right? So when somebody got diagnosed earlier with stage 0 breast cancer, most likely they will have maybe a simple mastectomy and that's it. So their chances of having lymphedema is very small because their lymph nodes is not affected. However, when somebody gets diagnosed with stage 2 lymphedema and they have a lumpectomy with radiation, which right now is a very common, actually do a post on my Instagram in July about this, because even though their chances for lymphedema in the arm is pretty small, which is 3%, but their chances of breast lymphedema, which is swelling in the breast, is higher, which is about 25%. So this is the reason why I just kind of want to connect this. Cancer do not normally cause lymphedema. Sometimes the tumor can be big enough. I've met a couple of patients who has tumor in their axilla that caused them to have really swollen arms. But those are the patients usually, they're probably have stage 4 cancer. I have this gentleman who came to me, and I don't know if you ever seen the movie Thor. I think Thor 3, when he has Krog, one of the guy that looks like a rock.
Yes.
Right? His body is made out of rock. So this gentleman's arm looks just like that. So I just want to just kind of picture for a second. So he has a tumor in his axilla that is a stage 4 cancer. And he just have growth all over his arm that makes him look like a rock. And really at that time, we were waiting for clearance from his doctor to proceed with treatment, but he never came back. So I don't really know what happened to him because he kind of get lost in the process. And, it's kind of like one of those awkward things where he's still around, but he might not be at the stage where he wants to receive therapy, right? Because he might be in hospice. So usually cancer do not cause lymphedema. However, in the later stage cancer, because the lymphatic system is heavily involved, they're going to be overproducing. Their arm's going to be more swollen. But at that stage, treatment will not be as effective and it's more for comfort.
Yeah. And I'll jump in for a second. I feel like a lot of times when we are talking about cancer, a lot of the times you're at least from what I've heard, and again, I don't work in the practice area, but it's mainly focused on radiation and chemo. And that's what I hear people talk about. I never really hear about people talking about the impact that those treatments combined with whatever stage cancer and then whatever cancer it is, how that could influence having a higher chance of lymphedema, and then having that lymphedema, what then that causes too. I feel like it's that piece of the puzzle that, at least for people not in kind of the cancer world and not working in that practice area, it's something that's just not really talked about and probably very, very, very misunderstood because it's not really kind of on the forefront of what people kind of outside of that world are talking about.
Right. Yes. I'm kind of like in a subset because in my lymphatic world, everybody's talking about it. But then I realized like nobody really talks about it. Even I was talking to one of my previous patients, like she graduated and she said a lot of people probably isn't even in denial because they don't want to call it lymphedema because there's just been such a stigma of lymphedema that so people are like, well, I don't have it. It doesn't really impact my function at this point. So I'm not going to deal with it. Because I mean, this is the stories that I've heard from a lot of my patients who have breast cancer. Like they thought cancer, like, okay, I can get through surgery. I'm good. I can get through chemotherapy because there's weeks attached to that, right? And I can get through 5 weeks of radiation. I'm fine. But then they're finished with radiation. They're finished with their reconstruction surgery. And then all of a sudden, out of nowhere, their arms start swelling. And that is very devastating to them because they thought they were done. They thought that they can put cancer behind them. But then this really aggravating and inconvenient swelling show up out of nowhere. And that is the hard one to really, really swallow for them because even I'm afraid to talk about it during prehabilitation, right? Because sometimes I see them before surgery and I have to kind of educate them about lymphedema, but I don't want to put that on them because they may not have it, right? They may only have a little bit. But what they didn't know is that lymphedema management requires lifestyle changes that are not fun, especially when you live in where I am in Houston, Texas, where it's like 100 degrees right now outside.
Oh, gosh.
Right? So I think a lot of people are having a hard time just even processing that, hey, this is something that... So here's the thing too, like I think I remember too, like a lot of these women, I'm specifically talking about breast cancer survivors, they were completely healthy before breast cancer happened to them. I mean, I have a young patient recently. She's only 30 years old. She just had a baby when they found her cancer, right? So a lot of these people are just like you and me. We exercise, we try to eat healthy, we go to work, we're a healthcare professional. And then all of a sudden, out of nowhere, cancer was bestowed upon us. And it's almost like you went through this shock of like trauma of the C word, right? Cancer. What's next? Because right now, the survival rate of cancer is quite high, but then there's still so many people who wrestle with cancer. So, I mean, I lost one of my dearest co-workers a year and a half ago from her battle with breast cancer after 3.5 years. She was the most healthy PT I've ever met, the sweetest. She was caring mom. Everybody loves her. And she found her cancer when it was already spread to her bone at stage 3.
Jeez.
So I think it's just like, just even the trauma, number one, talking about trauma, because I'm really also highly interested in the topic of trauma as it relates to physical dysfunction and myofascial dysfunction and all that stuff. So if you think about being diagnosed with cancer, that is a trauma in itself because nobody wants to get diagnosed with cancer. And then let's talk about chemotherapy for a second. I mean, the nausea that comes with it, the hair loss that comes with it, even the joint pain, joint aches, they have cramping in their legs, they have neuropathy. I mean, different side effects of chemotherapy. That is traumatizing to a body and to a soul, right? And to spirit, I think. And then think about radiation, 35 session where they have to raise their arm up high and be under a radiation beam for 20 minutes for 35 days. I mean, radiation beam, until you get under it, you don't know what it's going to do to your body. So it causes radiation fibrosis. It can cause like a burn to your skin. Some people have wounds from radiation. Some people have only sunburn. So you don't know what you're going to get until you're there. So that causes extreme fatigue that causes you to not able to function after. And now because we are diagnosed with breast cancer a lot younger. So now I have patients who have to work full time while they're going through radiation and have 2 young kids that they have to take care of and a husband who helped a lot too. But I mean, at the same time, like all that together, you package them into one time and that's trauma.
Oh, and lots of little and lots of huge, just like drastic ways. And I think I keep coming back to this thought of when you said that lymphedema and lifestyle, right? Like when you're experiencing lymphedema, and specifically right now we're talking about cancer-related, it impacts everything within a person's life. It impacts their lifestyle. It impacts their occupations, how they do things, if they can even do it. And then just kind of compound that with the trauma and just kind of having to go through all of these different procedures and doctor's appointments and the disruption, right? It's all about this disruption to their life that they had before. And I think that right there is really why occupational therapy practitioners are so perfectly poised to be working in this world within this population, because who better to talk about occupations and talk about lifestyle than us right here.
Yeah, no, I mean, I so agree, because a lot of times my treatment, like from the outside, it looks like I'm doing manual lymphatic drainage, right? I'm doing scar tissue massage. I teach them how to do their range of motion and their exercise. However, the conversation that took place during that session, I mean, I address, okay, my arm is more swollen today. What's happening? So I go through like, okay, what did you do yesterday? Like what exactly, like what's happening? Like really pinpointing the area in their life that may have caused them to be more swollen. So that is fair occupation based, I feel like, because we don't realize how much our body is changed because of all this treatment that they go through during cancer. And not to mention the chemo brain. I mean, chemo brain is real. My patient can tell you that. You know, they become more forgetful, they become more fatigued. And then on top of it, from the outside looking in, they're still the same person. So the expectation that their children place on them, the expectation that maybe their husband place on them, and the expectation that even their coworkers and managers place on them, right? I mean, you're the same person. You're still Emilia, you're still Sarah. So why can't you do all these things that you used to do? What they didn't understand is behind this body of like the Emilia and Sarah is that a person that's whose life completely changed because of cancer. So that is in itself, it's just like, I mean, you know, like your perception of how you do your occupation, your perception of yourself has completely changed. So that is something that is not really addressed.
I mean, it's not just the physical aspect of lymphedema and the body and the physiological and all the anatomy and all that kind of stuff. There's also this other aspect of the mental health and the spiritual side and the kind of that self-concept of people. Because I can only imagine somebody that this would happen to them, and then they are still expecting themselves to be able to do what they used to be able to do. And then
exactly,
like trying to recognize and like reconcile that of like, I should be able to do X, Y, and Z, these things that bring meaning and purpose to my life and helping my family and whatever it is in my job. But then all of a sudden, then when they can't do those things that they used to, or at least be able to do it the same efficient way or whatever, how much that can actually impact their own kind of mental well-being and their own concept about themselves as a person.
Especially when it relates to exercise, because right now we're a culture where exercise is huge, right? I mean, people exercise, people do gardening, people go outside, they want to go to the beach and swim. And there's a lot of we call it risk reduction practice in lymphedema that's been sort of proven by research to be, I think it's a lot of debate. It's a controversy because we used to say that no exercise, no blood pressure cuff on the affected side, no like sauna and different things. But I think some of them have been shown to be like not completely true, while others are still true. So it's almost like I have to teach my patient. But this is something that, okay, this might be digressing a little bit, and
it's okay.
Might be a little off. But, you know, I've heard recently when I went to a trauma training, you know, how a woman can completely dissociate from herself whenever she was giving birth and then come back in. Like there's actually training on YouTube teaching women how to dissociate. So then they don't have to feel the pain, right? So talking about that, but if you kind of bring it back to like somebody who's going through cancer, right? I'm finding through trauma training that this self-dissociation is a way for us to cope. So if you think about somebody who's going through cancer treatment, they lost their hair maybe, they lost their breasts, they have scars in their body, and they also lost sensation in their body because of the surgery. I mean, I don't think we have studies enough like how that coping strategy may have been used by them in terms of like coping, and then how to integrate back to themselves. Like, you know, like I think we talk about that, just self-concepts and how people perceive them and how to integrate them back and like to, okay, this is me after the cancer. So I kind of make it a point now to talk to my patient about allowing themselves to grieve in this process, because a lot of time they are expected to return to work. They have a deadline. Okay, my insurance is running out by this month, so I need to finish all my treatment so that I don't have to pay my out-of-pocket max anymore. So they have this deadline. Oh, I need to be able to recover in 4 weeks because I need to start radiation. I need to be able to recover in 8 weeks because I'm returning to work. So they're not really allowing themselves to process this emotion that, hey, you got cancer, especially the one who has a lot of hats, like the moms and the workers, the therapists, the wives, like they don't allow themselves because they have to go back to their duties because otherwise nobody else is going to do it for them. So I told them like, you know, in a way, cancer is a big trauma in your life. And it's okay for you to grieve through it. And it's okay for you to process with it and to know that you're not the same anymore as you were before. And they may not be ready the first time. They may be ready a year later. But I think that's kind of our role as a therapist, is not to shove down all the rules. Hey, this is lymphedema. This is all the things you have to change. But provide them, hey, this is a map. Like, right, this is how you can navigate your new chronic disease called lymphedema. And you can choose which way you want to go. And I'm here to guide you. And I think the biggest thing that I can want to make an impact on my patient is that so that they know when they have a problem, they can always go back to me or somebody else who can help them navigate through their issues. Because a lot of time, I mean, I really appreciate the change readiness theory in this stage more now than I was 5 years ago. But I was like, a lot of people need that time to process their change. And they can't completely change their life 100% for me in that moment, just after radiation, just after cancer. But maybe 3 years from now, when they actually have lymphedema and their lymphedema affecting their life a little bit more, they remember, oh yeah, I have that lymphedema therapist who told me about these things. Maybe I can go back there and ask her to help me navigate again. So I always think of whatever I do as a seed. If they don't do it, I don't get offended. It's okay. It's their life, not my life, but I'm still going to try to provide them with the best information, evidence-based research, so that they can decide for themselves. And I think in itself also, especially with this population, I mean, I met some of the strongest women and the kindest women. And it's just amazing that I think sometimes when we just give them the navigation, it's like, hey, this is what I would recommend, but it's kind of up to you where you want to go with this. It's going to give them their choice back again. Because a lot of time in cancer, they don't have a choice. They have to have surgery. They have to have chemotherapy. And they have to have radiation.
Seriously, like so much stuff that you just said right there. And I think that this is huge in your practice area. And I think this can really kind of transcend different practice areas, because a lot of times when our clients come to us, they have experienced some sort of trauma, right? Like maybe they just got a diagnosis. Maybe they just had some sort of surgery. Maybe they are, like for me, it could be a kid that they are thinking that there might be some developmental delays, like whatever that trauma is, that they come to us. And here we are, like, we're passionate about it. We have years of experience with this. Like there's teams of doctors and other professionals that are around to help. But a lot of times it's like, it's a lot for that person and their family, right? And their caregivers or whoever's supporting them to go through. And I think it really is that awareness piece and awareness for the clients, but then also for us to understand, to be able to meet them where they're at. And I love how you said that your goal is like just to give them a map or to plant the seed. You could talk their ear off for hours and hours and days and weeks and however long. Like you could probably talk about this forever. But if that person, that client in front of you is not ready to hear it, then there's no good about it. But it's almost just sharing like, hey, these are a few things that could help, or a few resources, or a few things just so you know. And then if you're ready now, let's dig in, let's get into it. But if not, like we'll talk about it in a week, or we'll talk about it in a couple months, or maybe even a couple years. Like you said, they might reach out to somebody else. But it really is just being there and helping them with their own awareness and helping them kind of work through this trauma that they're going through. And then providing the resources for if or when they might need it somewhere down the road.
Absolutely. Yes. That's why, like, I think the method of like, oh, you either do this or this is all the bad things going to happen to you doesn't really work for them. Because I mean, I think I have to appreciate that they're grieving, that maybe they won't even tell you, but I think they're grieving inside. So, I think it's just, I think the approach of like treating them as adults, that who they are, and just like, hey, I honor you and I really want the best for you. And this is what I can give you. So, so you can make your options.
Yeah. And I think really kind of bringing it back to the whole kind of OT side of it is that it sounds like we can come in and really have this holistic approach where you're not only doing manual therapy or you're not only doing a certain protocol or a certain treatment, but you can really kind of come in holistically and look at the person and then be able to kind of tailor the treatment and tailor the treatment plan and the plan of care of like what it is that will specifically help this person during the time that they're with you, but then hopefully moving forward as they kind of progress through their journey and their recovery.
Yes. And I do love manual therapy. So I do a lot of manual therapy. I actually studied myofascial release under John Barnes, and he is very fascinating. I mean, I can talk hours about him too, and just his approach of like healing and trauma and myofascia. But it's almost like I want to give my patient results, right? I mean, a lot of them come to me with pain because of their scars or pain because they can't move their arm. So if I show them that, okay, here's a result that I can give you, I help you with your pain, I'm just hoping that it becomes a deposit to their healing and their journey so that if someday they have issues surrounding things that they're not ready to talk for, then they're going to come back to me because they know, hey, last time I was with Emilia, she actually helped me with my problem. So I'm going to go back because that's what makes our patient go back to us, not the knowledge that we have, not all these degrees that we have. They don't care that we have an OTD or a master's or we have a occupational therapy assistant. They don't care about that. They care that you're there for them and they care that you're providing results for them. So that's why I do a lot of manual therapy, because when people are in pain, I mean, that's the only thing they can talk about and they can think about. So when I can help them with their pain, and then also pain and tightness and scars are actually connected with lymphedema. So when I help them with them, I help them with lymphedema. So, but yes, I use that as my in with the patient, because then I can be somebody that they can trust because, hey, when I'm with her, my pain goes away.
Now, I know there's a lot of different interventions and kind of different things that you do, but there's one that I have seen on Instagram. And so I got to bring it up. I got to talk about it. Can you share and shed a little bit of light and information about the plunger and how you use a plunger in your interventions? Because it's not something that I've ever thought about, like, oh, this could be a treatment intervention. So yeah, that one caught my attention.
Yes. So plunger, I discovered plunger when I first started working in my work because one of my wonderful occupational therapy assistant, she's been working for 25 years. She's like my mom at work. She showed me this plunger technique because all of our patients with stroke has tight shoulder blades. I mean, can you say amen to that? I mean, everybody has it, right? Because of spastic hemiplegia. So I was like, what else can I do? So she showed me this technique with a plunger where instead of using your hands, because basically, ideally, you want to do scapular mobilization. And to do that, you need to loosen up the tissue surrounding the scapula, including the rhomboids and packs and all that stuff. So using the plunger saved me my hand, number one. Mm-hmm. And number two, it just creates this kind of like decompression effect for the soft tissue. So it just loosened up in the moment. And I mean, you need to buy one, by the way. I'll tell you what to get. But the impact that the patient has, just the pain relief for that moment, I mean, it just feels really good. So again, I'm using the really good factor to get my patient to get motivated to do exercise. But I mean, I think I have to give something, to my patients as a buy-in so they can keep coming back. Therapy like that will help them to move forward in their life. So I use a plunger as a way to do soft tissue mobilization. And because the plunger is bigger, so I think in one of my posts, somebody comments about cuppings. I do love cuppings too.
I was going to say the plunger is kind of like cupping.
Yes, exactly. But it's bigger, right? Because it's 4 inch, while a cup is about 2 inch. Okay. So the cups is a little bit more precise. And when you leave it long, like the way Chinese cupping works, it actually pulls all the blood to the skin and it will leave you with a bruise.
Mm-hmm. Oh, I've had it done.
Yes. So
I know.
I have a funny story about that. Like a little kid who put my cups on her forehead and then anyway. So with plunger, I just like it because it's a little bit bigger. And if I teach my patient properly, using it for 3 to 5 seconds on each spot, I will know for sure that will not harm them. Because when you have that impact where it bruises skin, for somebody who has at risk for lymphedema, that may not be the best option for them because it can cause that rush of blood and rush of fluid in the area, but their body is not efficient in processing that fluid anymore. So then it can get stuck there. So I don't want that for my patients who are at risk for lymphedema. So that's why I use the plunger, because usually they're like, oh, at first they would be like, Emilia, what's that? Is that a toilet plunger? They always joke. And I was like, no, this is clean. I buy it just for you. And after I use it for them at several sessions, I would say 50-60% of my patients actually end up buying their own plunger so they can use it at home. But this is actually not a new toy to therapy. I mean, physical therapists have used it for so long, like traditionally to mobilize more of the quads muscle and the knee muscles because it's bigger. Mm-hmm. So yes.
Yeah. Well, I think it's fascinating because, I mean, being a pediatric therapist, like we're always using weird things within our interventions and our treatment sessions. So when I saw that, I was like, hold up, I need to know more about this. And now that you're explaining it, I'm like, oh, that totally makes sense. But my one question that I had about using the plunger, is it something that you can teach your clients to do themselves, or do they need to have somebody with them to help, or maybe a combination of both? How does that work?
So it can be both. So for some body parts like the scalp, the rhomboids and the upper traps, it's a little hard to do yourself, especially if you don't have a good range of motion to begin with. So that's when I usually teach their family member on what to do, or I teach them so they can teach their family member. Because if they know how to do it, then they can walk their family member through it. But if you're covering areas like under the armpit, which is another area where people get stuck, because that's where your infraspinatus, your lats, everything attach kind of right there. So that they can do themselves. Or if they just have tight forearm, for example, you can do that yourself. Certain body parts you can do yourself, because I use plunger for my own recovery at home. So
yeah, we're gonna have to talk about this, because I think it might need to be something that I integrate into some of the stuff that I do too. Like as we're talking, I'm totally like pulling my shoulders back and like trying to sit up straighter. I'm like, oh yeah, as you're mentioning those body parts,
yes.
I'm like, I'm totally slouching, and I know I got my own stuff going on over there. So are there any other maybe like favorite interventions or like methodologies or anything that you use that would like within lymphedema that they're like your jam that you love to do?
Okay, one of my favorite interventions to do is kinesiotaping. I talk about it all the time, but it is amazing. So I think I learned kinesiotape at work, because it's not something that we learn from in OT school, right? Because a lot of our patients who has a stroke, they have a swelling in their hands. So that's like they show me how to tape them and stuff like that. But I didn't really get certified in taping until I took a course from Rock Tape last year, I think, or a couple of years ago. But I just took a few classes in taping for lymphedema. And that's how I started using it. And I bought a book, and then I used the book and then watch a lot of videos on how to tape. But I just love it and specifically for lymphedema, because number one, with cancer-related lymphedema, a lot of my patients have scar tissue. So the fluid will tend to want to hang out just right on top of the scar. Because if you think about the scar, it's like a snug in your clothes, right? Where everything get caught. So taping really get good, because sometimes compression cannot go there, like especially in the breast or in the armpit, like we can't compress that as well. But tape, you just put it on your skin, and it provides proprioceptive input, number one. It provides sensory input. And then also it lifts up the skin a little bit so the fluid can flow better. That's the idea. So I use taping on all of my patients who can tolerate it, because not everybody can tolerate the tape. Now, another one that I like to use taping for is cording. So I talk about cording recently because it's one of the side effects of breast cancer treatment, which is the lymph nodes removal. So when lymph nodes are removed, the lymphatic vessels around it, this is the story of cording, the lymphatic vessels surrounding the lymph nodes that's being removed hardens because of scar tissue. So it creates this effect like a spaghetti strings or like a guitar strings in your armpit, sometimes all the way down to your wrist. That limits your range of motion. So I learned this from a therapist, but you can put a small thin layer of tape over that cord, and it will just really calm the cord down and allow you to have more motion. So I will have to do a video on that soon.
Yeah, please do. Because I think I've done a little bit of like kinesiotaping in that, like I really haven't been able to use it in practice, but yeah, so much of this I think is really, really, really interesting. And I think can have such a big impact for our clients and their ability to engage in occupations and be able to do the things that they need to do and want to do. So what do you think? You've shared so much already. And I know there's still more that we could dive into, but what do you think are some of the most important factors for occupational therapy practitioners or maybe OT students or OTA students that are interested in working more within the field of lymphedema?
That is a good question. I think number one, we need more lymphedema therapists, because there's not a lot of us, and there are more patients every single year. I think what we have is a lot of patients and not enough therapists. So we definitely need the training, and the training is costly. Yes, I think it's about $3,000 now for 135 hours of CEUs. And it's about 2 weeks, 10 days to 2 weeks of your time. But at the same time, even, like I was talking about this to my friend this morning, because of COVID-19, many people are more sedentary at home, right? And what comes with sedentary is sitting down on the couch and lack of muscle activation. And all that can cause more swelling. So even in our patients with neurological conditions who normally will be walking around to go to Kroger or to go to the park, now they're no longer able to do that because their doctors tell them to stay at home. So I've seen a rise in like patients who get worse lymphedema because of this, because they're not doing the things that they used to do. So we're going to see more numbers of patients, and we need more therapists. So that is like, I think to me, like, I hope that through this talk, I at least pique your interest about the lymphatic system and the importance of it, if not for patients, but for your own body. So then my hope is, I always joke about this, but I just hope that you won't be my patients 30 years from now. Because number one, hopefully I won't be practicing 30 years from now. But number two, I'm hoping by raising awareness of the importance of your lymphatic system, I can educate more people to take care of their own lymphatic system. So then they can teach their family member and their moms and their kids. So then hopefully we can reduce the amount of lymphedema or lymphatic related disorder that is preventable. So I'm hoping that I can be a resource for the listeners, and I can be a resource for OT community online and in person in Houston if you're around. And just like, like, hey, this is something that we need to talk about with our family members. I mean, with my mom, I talked to her about that. I talked to her about stretching and exercise with the hope that I can prevent the chronic implication of lymphedema.
Yeah. I think this is just a perfect segue, because I know you had kind of mentioned about your Instagram page, and really that your goal is to raise awareness so people start to understand and hopefully don't have to become your patient or somebody else's patient later down the road. So maybe let's take a minute and just kind of share a little bit about what you have going on with the lymph therapist on Instagram and anything else that you kind of have going on in your professional role right now.
Yes. So I made my Instagram to be more public and kind of like more, I guess, educational page starting in April. But I think it's my biggest point is twofold. Number one, I'm really passionate about OT because I think OT is a wonderful profession, but we do need to justify ourselves, right? A lot in the workplace, right? Because otherwise we're just becoming a blend of PT-OT, and we're definitely bringing something different than our colleagues do. I love my PTs and my speech therapists, don't get me wrong, but I think we bring something else to the table that they need also. And the second thing is the lymphatic awareness. Yes, because I've seen it all the time. I've seen coworkers who have to go through multiple health conditions because something is going on with their lymphatic system. Or I've seen patients who is told by medical community that your leg just swollen. There's nothing you can do about it. Or this is my favorite. You're just fat. You just need to have a diet and get rid of the swelling. And this is a doctor telling them that, so that kind of hurts me because I'm like, I don't think you understand that these people have tried everything to kind of lose the weight. There's a condition called lymphedema, which basically a fat disorder where they can't just lose the fat because they're born with it. There's different ways where they can do to manage that, but that's besides the point. So I just kind of want to raise awareness of the different, cases of lymphatic system and lymphatic dysfunction and how that can affect us, because I think early intervention and prevention is key. So that's kind of what I've going on with my Instagram page. And I'm building my website, hopefully to be a resource for OT practitioners, OT students, and lymphedema therapists who want to know more about what type of courses available or like different treatment approach that I have learned along the ways. That's where I want to get started so far. And professionally at work, I am working with 2 wonderful fellows right now who's going to go through a rotation of neurorehabilitation from acute care all the way to outpatient. So that is exciting because I navigate a lot now with mentors, other OT practitioners, teachers, and also learning how to mentor fellows myself. That's very interesting and exciting. And the reason why I'm so excited about this, because in my hospital, we have had PT residency for 10 years. But this is the first year that we have an OT residency, or now we call it fellowship because AOT changed the name. So
awesome.
I think that's just like an accomplishment in itself, because I'm like, I think as OTs, we need to stay our course. And OT entrepreneurship is great, and I would like to go there someday. But if you're in a hospital system, then please hold your place there and don't let your place and significance be diminished by what other people are doing because you're not speaking for yourself. In fact, one of my colleagues was telling me recently she has to present to her management team why OT need to be working with patients with COVID, because they're like, well, PT working with them, we don't need to waste another N95 mask on you. Literally, that's what they said. So she had to create this presentation on what OT is doing in the ICUs and what OT is providing for these patients to help them to go home. And now they're working with the patient with COVID. So if that's you out there and your hospital telling you that, like, oh, PT is working with them, you don't need to be working with them, then please share the value of OT and don't be afraid to speak up, because we need all of you to speak up, so then our profession will not die.
Yeah, 100%. I resonate with so much of what you just said about just, like one of my previous podcast guests, and this was, it's probably been over a year since this episode came out, but this was Sarah Lyon from OT Potential. But she said, not only do we want to have a seat at the table, but we want to be a leader at that table. And I was just like, yes, exactly. Like it's not enough for us just to be there. Like we need to be having an influence and showing up and making sure that like people know who we are, what we do, and what we contribute, especially with this kind of ever-changing healthcare climate with the pandemic. And there have been some great like articles that are coming out and some news things that are coming out that are saying that OTs are doing really good work, but it's not enough, right? Like we need to keep pushing and we need to keep striving. And especially in practice areas that OT might not have a huge place in right now, but should, right? That we need to get in there. We need to get in there and really prove that like, hey, we can make a huge difference. And it's not just PT, right? We love our PT friends and we love all our other professionals, but it's like, we're here and we really have something special to contribute to, say, lymphedema world or another kind of emerging practice area and that kind of stuff. So I absolutely love what you stand for and your mission and everything that you have going on so far. So is there anything else that you want to share that you feel like we didn't talk about yet in the episode? I know we've covered a lot, but is there anything else that comes to mind that you want to share?
I was thinking about it because I think a lot of times when people see lymphedema management, what they see is the big legs on TV. And that scares them away from it, right? Because nobody wants to treat the big wounded legs on TV. And it is a lot of hard work. But at the same time, there's just so many other niche area of lymphedema that you can specialize in and be an expert in. And lymphedema therapy is more than the big legs that you see on TV when you hear the word lymphedema, because it's attached to like when we talk about cancer-related lymphedema, but also just the beauty of like learning the lymphatic system that we are now starting to uncover, because there's more studies, more imaging that we can do with the lymphatic system.
All right. So if people want to connect with you and find out more resources, more information, where can they find you?
They can find me on Instagram. My Instagram handle is _lymph_therapist. Or they can find me on my website. It's www.thelymftherapist.com. So that would be the two easiest way to find me. I have my emails there. You can DM me on Instagram. I answer every DM, except the one that I would say if you DM me, just kind of like give a paragraph on why you're asking something instead of just hi, because I'm not sure what to do when that's the case. Are you just saying hi, but then why? Because I don't really know you. So, so if you have a question, please just introduce yourself and shoot me your question and I would answer it the best that I can.
I have one last question for you. Are you ready?
Sure. Yes.
Okay. One word. If you only had one word to describe occupational therapy, what would it be?
Only one word.
Only one. Yeah, that's what makes it fun. Only one. Okay. Because I know we could talk about this forever and have so much to say about our wonderful profession, but you get one word.
Okay. Innovation. I'm using innovation because I remember the reason why I became an OT was actually I was observing in a clinic for pediatrics. I thought I want to be a pediatric OT, but I was like, no, when I graduated. But I was observing in a pediatric clinic and the therapist was sharing a story about how she helped this young girl who had an accident. She was not able to ride a horse again and she loved riding horses. And she helped to create this adaptation to her saddle and stuff like that. So then this girl can ride a horse again. So to me, that embodies what occupational therapy is, because you take somebody who's been through a trauma and you help them innovate a different way, a tool, or helps them innovate with your own body, like how to get back to that previous thing that they want to do. So I think OT is, I'm not a creative person, I don't do art, I don't sing, but creative problem solving has always been my strength, because that to me embodies OT, like innovating, problem solving, helping.
100%. And being that I grew up riding horses, like that example, I was like, yep, I love that. Like, that's amazing. And I do think that that is something that we as occupational therapy practitioners are so good at. And I love that you said that you're not creative, because as soon as you said that, I was like, yeah, well, that's not right, because you are creative. But I think so often people think creativity is art, right? It's writing, it's coloring, drawing, painting, photography. It's more those artistic things, but I am not creative either. But it's that creative problem solving that I'm like, yeah, like I absolutely I thrive on seeing a problem and then trying to come up with like a clever way to address that problem for, maybe for myself or for my family members or for friends or anything like that. So you are creative. And I think that's just a perfect word for OT.
Yep, absolutely.
All right. I absolutely loved this conversation. And I feel like I say this on every single episode. Like, I've learned so much, and I'm like, I can't wait to even get more and more information about this practice area and working in lymphedema. And this has just been amazing, like mind blowing, basically. Like I said that in the beginning, like so much of what you shared, I'm just like, wow. It's incredible how much I think OTs and occupational therapy practitioners can really bring to the table within this practice area. And so thank you, Emilia, for coming on the show, sharing your passion, sharing some of these stories and experiences that you've gone through, and really shedding a light on lymphedema and why it's important and why we as OT practitioners need to be addressing it.
Yes, thank you. I would like to see more OTs on board in the lymphedema world, and I hope to hear from you guys. Thank you.
Thanks for listening to today's episode. If you like what you hear, here are 3 easy ways you can help support the show. 1, head over to otforlife.com to find out more about any resources discussed on the show. Remember, that's OT4LYFE.com. 2, share the podcast with a friend, colleague, or anyone interested in occupational therapy. 3, subscribe to the show on your favorite podcast player so you don't miss out on any upcoming episodes. And while you're there, be sure to leave a review saying how much you love the show. Thanks again. I'll catch you next time, OT for Lifers. Okay, take a deep breath, because,
Yes, take a deep breath. And that's something that we can, what do you call it? You froze for a second, but I was like, that's something that is worthy of, you froze again. So yes.
I know.
Did you hear me? Like, I was like, I'm just going to bring Shantae to the table. What is that? Sorry. This
Dementia?
I'm going to check really quick.
Yeah.
So you can edit it.
Yep.
And I'm going to repeat that again.
Yeah, no worries. This is exactly it. So this just happens. I don't like when podcasts are like, see how I do this. And it's like, well, no.
I can't see you.
I can't see what's going on. So
I always say yes to all these things. So yes, I mean, let's do it.
And I'm like, how much you want? $20? $100? Like, yeah. Take
exactly.
My money.
No, exactly. Because I don't really think OT is just fluffy and cloud and candy, right? I mean, we do with the hard stuff too. Like, I mean, we are more as capable as PT to provide the manual therapy, but we do it with a bling, which is the psychosocial aspect of things. And not all OTs have to do manual therapy. I mean, some people are not comfortable with it, and I'm okay with that.
Right.
But I think if somebody is in pain, you need to be able to address, if you're in fistus especially, like you need to be able to address their pain, and at least in a minimal way, on like how to make them better. What we need is leaders to sit at the table and make decisions.
Radiation and, why am I blanking? Radiation and
chemotherapy.
Thank you. See, you like just said it, and I'm like, I can't remember.
I think I was going somewhere with this. Hold on. Dissociation.
Don't worry. It happens. Feel free to talk through it, because sometimes it helps. I'd said something about like the mental health and the like self-concept. Does that help?
I think so, because I was dissociation. Okay. So yes. I think that's what I want to say. You can cut that out probably. That's okay.
No. It's good.
It's okay. It's okay. It's good. I'm not going to be one of the ones who tell them that, hey, this is...
Uh-oh. I can't hear you.
exactly how you need to do how. Oh, dang. Okay, can you hear me?
Yeah. That was weird.
I think I've unplugged it by accident. So
okay. All of a sudden I'm like, I can tell you're talking. I can't hear anything.
It's okay. Yeah. It was just, yeah, I think I probably already covered it. So you probably can cut that part.
Yeah. Okay. And I had a question. Oh, no. Did I have a follow-up question about the plunger? Yeah, I did. Sorry. I had two questions, but one kind of takes us off of it. So what does it have to do with?
Oh, wait. Can you repeat that again?
Yeah. So is there anything else that what did I want to say?
It's going to be a long, awkward pause.
That's okay. I can cut it out.
I talk about this all the time, so I'm excited. Talk about lymphedema. Life is good.